Hello and welcome back to the Open Mind with you, friends. Today I am going to talk about completely different topic, right? So get ready. Stay till the end because many of you have been exiting very quickly and helping me study the human psychology just by looking at the analytics. Okay, that was really seriously speaking. So let's get started. Now, who doesn't want to make profit? किसको पैसा और बनाना नहीं अच्छा लगता है? मुझे भी अच्छा लगता है, शायद आपको भी अच्छा लगता होगा। दुनिया में काफ़ी सारे ऐसे लोग हैं जिनको ये अच्छा लगता है। वेल प्रैक्टिकली एवरीवन वांट्स टू मेक प्रॉफिट एंड मोर प्रॉफिट एंड मोर गेन फ्रॉम वॉट एवर एक्टिविटीज़ दे आर डूइंग, राइट? सो today I want to talk about at least a couple of incidents which have been experienced by the family in relation to once again the medical field. Unfortunately, medicine is something, that field is something जिसकी हमें ज़्यादा जानकारी नहीं है और उसकी वजह से हम लोग काफ़ी सारे फंस सकते हैं. आई एम यूजिंग द वर्ड डेलिबरेटली. वी गेट ट्रैप्ड बिकॉज it is you know it is directly related to our life, living and possibly dying also. So the story is the real story. It's not the story, it's a real life story which has happened in the last 2 months. So my father had to be given one injection which was quite expensive, and it was to be given as soon as possible as the doctor had recommended. So we checked with the obviously the chemist, where we thought it is not available everywhere. First of all, any Tom, Dick and Harry की chemist shop में नहीं मिलता है, so you have to go to a specific bigger chemist who is either outside a big hospital or something like that. So we contacted that person and he said okay, मिल जाएगा लेकिन 6 से 7 घंटा आपको वेट करना पड़ेगा, शाम तक दे दूंगा. I had called up in the afternoon, so I said okay, how much it will cost? 17,500. I was under the impression that it was to cost between 11 or 1200, and I said, oh, 17,500? He said, हाँ सर, ये मंगवाना पड़ता है, ये स्टॉक में नहीं रहता है. I said, okay, fine, I will let you know. Now, I had to call up my doctor uncle because I did not know that an injection could cost so much. So my doctor uncle, he asked me what is this injection for and all that, and then he said okay, that is correct. So I did some research. Now the good thing is that I just typed the injection name, and immediately Tata 1mg website came, and they had given complete information about what the injection is all about, what are the pros and cons, that कि इसमें इसको लगाने से आपको क्या रिएक्शन आ सकता है, क्या साइड इफ़ेक्ट्स आ सकती है, एंड हाउ मच इट इज़ कॉस्टिंग or likely to cost. At various 2 or 3 websites options were also given, and also alternate injections names and costing was also given. Very good website, and this is what I liked about this particular website, that they had given a lot of information. So immediately we contacted a few websites, and through the app we found out that the price was actually coming down as you go down. And then immediately after a few minutes my uncle called up. So he said he found something that on somewhere pharmacy this injection was available at 13,000. So I was 4,500 ka difference. So my son, stock markets with KR, he has a friend who has a chemist shop. So it's not a very big shop, so we did not check with him earlier. So he contacted, he said this is the injection required. So he said okay, it will cost, I am not able to recollect, but it will cost him so much. So then we found out that the prices were varying differently. And one person said that if you take this injection was from Sun Pharma. Sun Pharma is a very reputed company, right? And they said that if you take it from Bharat Biotech, it's the same injection, but the doctor had specifically mentioned Sun Pharma. सो वी कैनॉट डिविएट फ्रॉम दैट क्योंकि हमको मालूम नहीं है कि उसका इम्प्लीकेशन क्या हो सकता है. सो वी इंसिस्टेड ऑन सन फार्मा. भारत बायोटेक वॉज अवेलेबल एट आई थिंक बिटवीन 9,500 to 11,000. I am giving you the numbers so that you will know what is the range that we are talking about. Finally, on the third day, uh, my son's friend, he was able to contact the dealer in Mumbai, and finally we got a discount of around 4,500 or so from the price of 17,500. And on the fourth day, we received it in a very nice manner, in a refrigerated box because it needs to be maintained that way. And the injection was given, and fortunately, touch wood, the outcome is positive. It is giving good impact. Reaction there is positive as on the expected lines. लेकिन मैं ये सोच रहा हूँ कि जो 17,000 का कोट कर रहा है वो 5,000 का प्रॉफिट कर रहा है on the price that we paid and ultimately ended up paying. Now, the thing is that I have no problems in making profit either by me or by by everyone, because without making profit आप जी नहीं सकते. कॉस्ट के ऊपर ही आपको सब काम करना चाहिए. तो ये मैंने देखा कि and you know that pharmaceutical companies would also have their own cost structure etc. to meet and all that, and maybe they are having 100% profit margin. Fine, it's okay, I don't mind that as well. But the problem is that how will a common man like you and me know that there is this kind of margin being kept? Is this fair to a person who is seeking some kind of dosage which is very critical for the disease or illness that he or she is undergoing? अभी हमारे पास इतनी घाई नहीं थी. डॉक्टर ने बोला था एज सुन एज पॉसिबल, तो उन्होंने नहीं बोला था कि आज ही दे दो, ऐसा नहीं बोला था. तो वी वर एबल टू टेक टाइम, and within 4 days we were able to get this thing out. Now imagine a situation where the doctor for a patient says now. So now means 17,500, और ये कोई reimburse करने वाला है 17,500? I don't know whether injection given to an OPD patient will be reimbursed or not. I don't think so, unless it is in relation to a treatment which had taken place in a hospital and within 60 days or so. Lekin in case of my father, that was not the case. So why the pharma industry is charging so much? Where is the problem? Are the dealers pocketing the money, or who is pocketing the money, and who is depriving the citizens of India from getting benefited by cheaper and effective drugs? Who will think about this? My question is this: if you are from the pharma industry, or if you are from the medicine industry, please take this up for me and millions and billions of others, Indians, and help us get drugs at a reasonable price. Something like Government of India approved pricing. You cannot charge beyond that. Can we not have that kind of India for a change? If you agree with me, please like and share this video so that it helps us to make appeal to the right set of people. Thank you for your time.